Thank you for joining me today.
Pleasure to be here, Yasmin.
So Shayne, you've been a critical and fierce opponent of the government's move to cut the dementia and severe behaviours supplement. But recently Senator Mitch Fifield accused you of needing to come clean on how you plan to fund the supplement's reintroduction. So given that the supplement's forward estimates only accounted for 2,000 people to be eligible, not 25,000 plus people, how would your party suggest that the supplement gets reintroduced?
Well, let's get it straight. There are 330,000 Australians with dementia presently, and by 2050 there'll be 1 million. If you're over 65 years of age, you're 1 in 10 chance of suffering from dementia, and if you're over 85 years of age, you're about 1 in 4 chances. This is a really big problem. So what the government's done is they, without notice to anyone, without warning, have cut this supplement, which is $16.15 a day, to aged care providers in residential facilities. Now what it will do, it will mean that families will have to go into those facilities and provide the kind of assistance, support and help that residential aged care providers are currently providing. Now what the government could have done to solve this problem is consult with the industry before springing it on them as a shock. Consult with the industry, look at an audit process, look at compliance, look at training, look at the assessment tool. There's a lot of things they could have done. They didn't deal with this in my EFO at the end of last year. They didn't deal with this in the budget. They sat on their hands and did nothing, and out of the blue gave the industry, after taking away the aged care workforce payroll tax exemption supplement, get rid of that, they then sprung this on the industry. What they can do is what I said, sit down with the industry, sort it out, look at the changes I suggested, and that's the way forward.
So I'll get to the consultation that the government's proposed in a moment, but Senator Fifield has recently also reminded the opposition and the industry that this funding was never supposed to be core funding. It was introduced by the Labor government as an additional fund that was supposed to be targeting people with severe behaviours and people with, I guess you could call it, the worst cases of dementia, not everyone and anyone with dementia. So, I mean, the government was talking about a $52 million initial estimate in the forward estimates, which was being blown out to $780 million. How do you explain the difference in the figures?
For a start, it goes to show what a problem we have in dementia in the country. But secondly, what the government could have been doing is having some look at this, the design of the supplement, if there was an issue in relation to audit and compliance, in relation to training, and the assessment tool that was there, the government should have had a look at this. They should have had a look at it last year. Then they could have had a look at it before the budget. Didn't do any of this. So what they should have done is say to the industry, hey, we've got a problem in this space. We need to have a look at it, look at the redesign of the assessment tool, and then look at that for the way forward. But just to spring it on the industry, it came as a real shock subsequent to the budget, and announced what? During question time, without prior notice to the sector, without warning? That's not the way you do aged care in this country, and that's not the way the government should behave. It should show respect to those providers that are helping on the ground with people with dementia. And the facts are that it is not the core funding in relation to dementia, but it's for those people who have the most severe behavioural problems in dementia units, in residential aged care facilities, and that's why it's so outrageous what the government's done. It's for those people with very, very bad problems, and to cut that funding shows disrespect to those families and disrespect to the sector.
So you're saying that the government shouldn't have just cut it point blank, they should have identified that there was an issue in the spending and the expenditure in the forward estimates, and had gone to the sector and asked for a co-design to fix a serious issue. Is that what you're saying? Well,
when they came to power, they would have received a book in the sector for social services. They would have received briefings from public servants who designed this program in the first place. They would have had discussions with about issues forward estimates in terms of issues in relation to the rollout of the Living Longer, Living Better package, the workforce supplement, a whole range of areas, including dementia. What they should have done is be alert and look at the problems that were emerging, but they've showed no forward thinking whatsoever about this. All it is about is a budget of broken promises and cuts. And what they should have done back last year, when they knew there was a problem emerging, was have a discussion with Laser, with AXA, with CODA and the aged care providers all around the country, sitting down and looking at this problem as it emerged and looking at a redesign, better training, better compliance, better audit facilities, and that's the way they should have dealt with, not simply cut it and shock the sector.
The government's been quite clear that they're not introducing the same scheme with the same amount of funding per se. What does your party, the opposition party, propose the government do now in terms of the look and feel of a new dementia funding scheme?
Well, they should restore the dementia and severe behaviours supplement. They should do that straight away. And then they should sit down with the sector and talk about the future. They should bring in a compliance measure, proper auditing process, have a look at the assessment tool, have a look at the staff training for those people who do the assessments, the nurses, the doctors and the like, and sit down and work with the sector. But they've got to appreciate the fact that there is a major problem with dementia in this country, and it will continue to be a problem. With 1 million Australians by 2050, there will be ongoing difficulties in this area and people will face big challenges. But to just cut it off straight away doesn't show disrespect, it doesn't show forward thinking, it doesn't show an appreciation of the household and individual needs of Australians, nor of the sector at all.
If your party was in government at the moment, what would you be proposing in place of this supplement, or to better provide for the care of people with dementia and their families, given that it is going to cost so much money, 780 plus million, as proposed by the government?
Well, we would restore the dementia and severe behaviours.
Can you afford to?
We would restore it. We would restore it because we think it's important. We would sit down with the sector, look at audit, compliance, better training, better assessment tools. We'd sit down, and if there was a problem going forward, we'd fix it. And that's what we would sit down with the sector and make those changes. Now, what the government hasn't done is sit down with the sector prior. It's now having some consultation processes. If they pursue consultation in the way they did before the budget and in relation to the workforce supplement, where they showed no respect for the sector and no proper consultation, or in relation to the payroll tax exemption supplement, which we've been operating for 40 years, and then they spring it on the sector and cut that $653 million in the budget. If they show that degree of disrespect, lack of consultation, and lack of cooperation with the sector, then this sector is going to be in turmoil for years to come. We know that the margins in the aged care sector are very small. We know that because we've had assessments done in relation to the Financing Authority, which shows the margins are as low as 5.6%. Now, most businesses would like much larger margins than that. So the sector can't afford the cuts, and the people who are their clients in the sector can't afford those cuts.
So the government has bluntly said it is not reintroducing the dementia and severe behaviours supplement, the same scheme that it has just axed. However, it has committed to a co-design of a replacement scheme in which it will host a stakeholder forum on September 11. First of all, are you invited to that? Or any of the representatives of your party, are they invited to that forum?
Well, we haven't been invited. There's been a complete lack of bipartisanship across the space. When Labor was in government, we designed the Living Longer, Living Better strategy. It's $3.7 billion, a 10-year strategy to redesign the aged care sector. And we took not just the sector, but the then opposition, the coalition parties, into our confidence and met with them. Minister Butler was the minister at the relevant time and discussed this issue to the point where when this legislation went before the House of Representatives in the middle of last year, it was adopted as a bipartisan approach. And so the coalition gets in, and what do? Straight away. First, they get rid of the workforce supplement. They put some of that money in towards the scheme, but no conditionality for wages and conditions. Then they get rid of the aged care payroll tax exemption supplement, no consultation with us, just get rid of it. Commission of Audit style cut, right-wing ideological cut. And now they do this. Where's the bipartisanship? There's been no bipartisanship by this government, which doesn't even have a proper minister for the ageing.
So this issue of bipartisanship was raised yesterday by Bill Shorten, and it has also been raised by Senator Mitch Fifield himself. So the government has said publicly that they wish at the moment that there was a bipartisan approach to aged care. Your party's saying that you'd like a bipartisan approach to aged care. Why can't the two meet, and what's happening to create that bipartisan approach to aged care that both parties desire?
Well, Minister Fifield has never invited me, as the Shadow Minister for Ageing, into his office to have a conversation once. He's the relevant minister. They're the government, we're in the opposition. It is up to them to actually invite us to a meeting to sit down and talk about these issues. Not once. He's never got on the phone and had a conversation with me about any issue relating to aged care. Certainly not before the workforce supplement was cut, certainly not before the payroll tax exemption supplement was cut, and certainly not before the dementia and severe behaviour supplement was cut. No conversation with the opposition about this at all, not even the respect of a phone call saying, Shayne, this is what we're going to do, and this is why. Not at all. So bipartisanship has to come from the government of the day initially. We can show all the goodwill in the world, but we're going to stand up for those people who are vulnerable Australians and their families who've got dementia, those people who work in the workforce that need the help to get good wages and conditions, and we're going to stand up for those providers who actually need the kind of profitability to make sure their workers can get paid well, and the diversional therapy and the care that those clients need can actually be delivered. And so we're going to stand up for the sector in a way that the government has not done since the election.
If you do happen to get an email, text message or phone call inviting members of the opposition to Senator Fifield's office to talk about a bipartisan approach to aged care reform and future politics, would you accept it?
I'd be delighted to do so. I think it's very important. The aged care budget in this country costs the federal government $14 billion a year. It is a growing cost to the Australian community. But can I say, it's also a demonstration of the fact that as Australians we're living longer and hopefully living better. And it's a demonstration of the success of our country that we Australians are living a much longer life, and it's important that we have a bipartisan approach to aged care and ageing in this country as we go forward in the future. We want to make sure all Australians can get the quality care as they get older, and make sure that they can live their lives with financial security in the way that they want to and dream and aspire to when they retire from their full-time employment.
Bipartisan approach means that both parties have to come to the table. They have to agree and on certain issues, and they also have to budge on things and issues that they were previously fixed upon. Would you be prepared to compromise on aged care party stance at the moment in order to reach agreement on key issues like the dementia and severe behaviours funding?
I'd like to see key issues resolved. I'd like to come from a Labor point of view that those people who are most vulnerable, the poor, the disabled, the people who are suffering from ill health or come from a background where they have low incomes, are cared for and can get decent health care and decent aged care in this country. So I'll come from that Labor perspective and principle and belief system. We will go into any discussion to talk about resolving issues in relation to the aged care with those principles and philosophy behind us. But we are reasonable, practical people, and that's why when we were in government we reached out to the then opposition, the now government, to talk about the Living Longer, Living Better package and where we're going, not just for one term of government, but 10 years into the future. This government hasn't done that at all. This government is a government of cuts and broken promises. None of these things I talked about today are the sort of things that the industry knew about or forecast or dreamed that this would happen to them. And this is a government and a minister who actually has simply done to the sector what the sector never thought would happen, and that is disappoint and disillusion the sector. And I think what we're seeing now with the government of broken promises being delivered to not just Indigenous people, not just people who've got their kids in schools, not just remote and regional people, but people living in aged care facilities, and that's what's happening now with the dementia supplement.
The forum, the ministerial forum with stakeholders to co-design a solution to the dementia and severe behaviours funding issue, is due to be held on September 11th. What would be your party's desired outcome from that forum?
Well, I haven't been invited to the forum. I don't know what they're going to discuss. I presume they're going to discuss the dementia and severe behaviours supplement issue. But I would hope we would get a resolution. The government would go to that particular meeting, listening to the voices of the sector about making sure that people with dementia who are in residential aged care facilities will get the kind of assistance they need, whether it's activities or physiotherapy or occupational therapy or diversional activities, or just the kind of staffing to make sure that the ratios are correct. And that's what it's all about with this severe behaviours supplement. It's making sure that those people with dementia of that severity can get that support. So I hope the government listens to the sector. It hasn't listened to the sector on a variety of other issues. I hope they listen to the sector on the 11th of September.